Okay, I'm going to go ahead and get started here. So, welcome everyone. I'm delighted to have the opportunity to share the journey to health for all with everyone on the session today. Today, we're going to be hearing from Dr. Melissa Simon and the entire Health for All team through a panel discussion. The panel will include Angela from the Chicago Public Library, Eileen from Northwestern's Galter Library, and we have a team from the Center for Health Equity Transformation, including Nemo and Will, and they're joined by Araceli and Ivy, who will be moderating the session. The work that's presented today is carried out by a tremendous group of colleagues across several institutions, which we'll be hearing about a little bit later during the panel presentation. As a reminder, auto captioning is enabled. If you would like to use it, just click the little CC box at the bottom of your screen. Also, this session is being recorded. It will be made available after the symposium for 30 days on the symposium website. And then after that, all recordings will be transferred to the NNLM YouTube channel for later viewing. So I know I'm very excited to see all of the recordings on the NNLM YouTube channel, and I hope you check those out too. So without further ado, it is a sincere honor to introduce Dr. Melissa Simon. Dr. Simon is the George Gardner Professor of Clinical Gynecology. She's a professor of obstetrics and gynecology, preventive medicine, and also medical social sciences at Northwestern University, and the founding director of the Center for Health Equity Transformation at Northwestern. Dr. Simon's primary research interests are aimed at promoting health equity and eliminating health disparities among low-income and medically underserved people across the lifespan. She's made a tremendous impact in this area through a wide range of interventions that aim to reduce and eliminate such disparities. Dr. Simon is a real champion for inclusive excellence and has been an incredible partner and advocate for libraries. She was one of my first collaborators when I joined Galter Library all the way back in 2014, and this partnership has only grown stronger over time. So it is a sincere pleasure to welcome her to this session today. Thank you, Dr. Simon. We look forward to your remarks.
Thank you, Dr. Holmes. Always a pleasure. It's been a really remarkable, wonderful journey working with you and the Galter Library, Eileen, and the partners, including Angela at the Chicago Public Libraries, because libraries, in my mind, are the great equalizer in the world of inequities, especially through the pandemic. And for somebody like me who aims to really push for health justice in all areas, libraries and librarians are really some of the most trusted spaces and people, professionals in the country. And that is supported by research. And I think it's just incredible to be able to have this opportunity today. So thank you. Sorry, I'm going to just give a quick little overview of our center, our work, and then I'll let the rest of the experts on the panel kind of speak to different parts of it. Just to center everybody, I never assume anyone knows all the definitions, and really to understand how to advance health justice or justice in every form, it's really important to have the viewpoint of these definitions. And while I'm using a tree as the analogy, usually inequities, structural racism, injustices in any form are not organically produced. They are human made, but I just use this as an analogy. So in the upper left-hand corner, inequality really means that the process or the rule, the practice, the research protocol, inclusion, exclusion criteria, the way data are pulled, the algorithm is fundamentally bent. And that bent nature automatically favors certain people or populations, and also actively disadvantages other people or populations. And that's really critical in data science, health justice, et cetera. Equality in the upper right-hand corner. So I hear a lot about that's not unequal. It's actually, we have equality in this country. Well, then that would presume that, if we give everybody the same type of lift, or use the same search algorithm we've used for decades, or the same healthcare delivery practice, that we're going to get everybody to reach the tree and to reach that outcome or goal, the apple. But if that process, algorithm, practice, etc., policy is bent, there's no way that people on the other side of the tree, away from which the tree is bent, are going to reach the goal. There's just no way. It's not going to happen. And so the word equity becomes really critical in the lower left-hand corner, whereby you acknowledge, or we acknowledge, that something is biased somewhere, something's bent. And so the only way to get everybody to reach the goal, or the apple in this case, is to actually give them a different type of lift or support to get there. And then in the lower right-hand corner, in a true data justice, health equity framework, you then say, okay, how do we seek to unbend the tree? And I say that very intentionally, not straighten, but unbend the tree. Or do we have to plant a new tree and uproot the one that's in its place, that's currently there? And that applies to everything we do. You can use these set of definitions to help you move forward in everything, really. We also, in a health justice framework, acknowledge the deep and long history so that we can move forward, right? We have a deep and long history of slavery, racism, discrimination. That includes, right, in research as well. And so we really have to work hard to earn trust back, to earn trust in research, to earn trust in healthcare delivery, just to earn trust in general from communities that were traditionally marginalized. And that's really critical in this COVID era, because COVID has exposed existing health inequities and exacerbated them across the board. And moving out of this pandemic, we actually could falter more and create more inequities. So if we don't acknowledge this health justice and this justice framework, and really seek to, in every way possible, center equity and communities, we are not going to move forward. So it's really critical to acknowledge this stuff. So that leads me to say, we are at such an important time in history. And especially, I can say, in my lifetime, this will probably be the one most critical moment to advance the work that we do and to advance health justice in every single way we possibly can, because this is the window of opportunity where people know that there's inequities. We see them a little more clearly. And there are so many opportunities as policies change, as healthcare delivery practices change, as more research opportunities and data opportunities, data science opportunities come forth. This is our chance to create them in such a way that will actually be equitable for everybody, and to make sure then that there are no more two different cliffs. Because one way of seeing this is, right now, even in the city of Chicago, where we say there's two different cities, right, whereby the south and west sides tend to be categorized in one side, in one bucket, and then the rest of the city in another bucket or on another cliff. Why does one part of the city, or this green figurines on this picture, start at the edge of the cliff? And there's no safety net, no fence, no ambulance that works to help them at any stage of the way. Whereas the orange people on the other side of that on their cliff, there's a fence to prevent them from falling, a safety net if they fall through, and an ambulance that works, that has gas, and a GPS that works, right? And we talk about the green people as at risk, but actually they're systematically excluded and oppressed. And then with respect to this design and structure that's so important, how we create algorithms, how we create projects and programs, it's really critical to understand garbage in, garbage out. So the more community members and diverse people, including diverse scientists and staff and everybody, included up front in the design of something, in the design of an algorithm, and design of a healthcare policy or practice or research project, the better and more applicable it will be in the output and in the generalizability. So we got to look under the hood of the car, as Congressman John Lewis used to say. We also have to make sure as we design our research that we acknowledge the structural inequities in every single part of that pipeline, from the funder on the left side of that figure to the funding opportunity, right? Depending on how, like, for instance, NIH creates a funding opportunity, the scientists will then write the science that's needed to fulfill the funding opportunity language. And so if community partners are required, that's what's going to happen with the science that will be assembled to be responsive. And that science pipeline is really critical. So we spend a lot of time in our center focus on workforce development and making sure that diverse persons are helped through the entire pipeline, including high school and school, all the way through college, all the way up through the time they become PhDs or scientists, clinicians, public health professionals, social workers, everybody. And then how we create a study protocol. Again, like I said, it's really important to be very aware of inclusion and exclusion criteria and who you're partnering with. And then study participants, how we get people to actually participate and trust that the scientific team is going to be worthy of trusting them and to participate in research projects. And then how that research is disseminated, how the gatekeeping happens in the publication world. Every single part of this entire process is open to bias. And if we don't have more diverse people participating in research and conducting research, the research is not going to reflect our evolving demography in 2 decades from now. Because in 20 quick years from now, and 20 years goes by really fast, I don't want it to be frank, but with my age, but 20 years goes by really fast. And in 20 years, our already diverse country is going to be even more diverse. And so whatever's going into those research protocols now and whoever's participating, it better be generalizable 2 decades from now, really critical. Right now in clinical trials, diversity is woefully low. Black African Americans in our country make up about 13% of our population and only 5% of the clinical trial participants. With Latinos, it's we are about 18% of this country and only about 1% of the clinical trials, 1 to 2%. And it's even worse for Native Indigenous people here. And Asian, again, it's lower, relatively lower. So it's really critical that we acknowledge that. And I acknowledge that things like the Chicago Cancer Health Equity Collaborative, which Dr. Holmes has participated since the get-go to help us with the evaluation of all forms, has been critical to helping to improve things like cancer education, prevention, research, training and education around cancer disparities. And community partners have been at the table all the way through since this was founded in 2015. We also have community scientists, so groups of community leaders across Chicago who come into our bench science labs and actually provide input. Usually community engaged research happens outside in the community and the academics go to the community. Well, we bring the community into the academia, into the labs to really, the bench science labs to really push the needle on what's the relevance of the bench science that is so critical to developing more precise treatments for all populations. Well, are these bench scientists thinking about diversity and these issues up front in their research questions and whom they get the samples from at the bench? Really critical. So design thinking, right? This is one of the schematas of what design thinking is, and looking under the hood of the car is what we do. And that's what got us to this Health for All project. And it's what started us on a series of National Library of Medicine, thanks to them, GO8s and also a supplement as well. And This is what started our partnership with the Chicago Public Libraries. The Chicago Department of Public Health also has weighed into with this, as well as our local university science libraries, University of Chicago, University of Illinois, Chicago, in addition to Northeastern Illinois University, but also led by our wonderful leaders at Galter Health Sciences Library at Northwestern. And what we did is this is evolved from what we used to have as a card, a low tech or low fidelity version of this toolkit that is for really improving research or clinical trial literacy amongst community members and trying to bridge trust in clinical trial participation. And this toolkit that was originally a set of cards, physical cards, was tested across many diverse populations in different regions of the country, including Native Americans, Latinos, African Americans, different Asian groups. So this is a culmination of that work that has now been put on a website with videos and many different tools that are really helpful, and librarians have spearheaded the way in how to best use these tools. We also have spin-off projects from that, which included navigating wellness around preventive services. Given I was an immediate past member of the United States Preventive Services Task Force, I clearly saw a gap in the understanding of just people, everyday people, understanding what preventive services they needed to keep their health up and maintained. And so Navigating Wellness was born to, again, work with the libraries on how to create a tool and access what preventive services a person needs, and then connecting them to primary care. And then there's a well mama component that comes with that around perinatal care, understanding how deep our inequities are in this country with regards to perinatal care. And this is just some of the pictures of our website that we're building for the Navigating Wellness and for the Well Mama work as well. Again, our window of opportunities now, we need to be strategic and intentional about advancing health justice. And there's no level of trainings, although I think we all need to be trained in anti-racism and across the board, but there is no level of training or DEI officers and chief equity officers to get us out of this mess. And that in order to move forward, we have to be really strategic and intentional with everything we do in healthcare delivery, and also science and research. So thank you so much. Here's the contact information for our team and myself as well. And I look forward to opening this up with the panel.
Great. Thank you so much, Dr. Simon. And now I'm going to hand the virtual microphone over to Ivy and Araceli, who are going to moderate the panel discussion. Thank you.
Awesome. Thanks so much, Dr. Simon and Christy. So I'll get us started off with some questions. So for the group, walk us through the Health for All project. How did it start and what were some highlights along the way?
All right, you guys are quiet. Here we go. I'll start because I already said it a little bit. So it started with that notion that we can do better, and that we, meaning the scientists and the clinicians and the libraries, because I was looking for ways to better instill and avail access to basic education around healthcare, preventive services, and clinical trial participation. And so I was like Googling and searching through, and I'm like, well, all the different spaces. I thought about pharmacies like Walgreens, CVS, et cetera, being a place of frequent traffic. But then libraries popped out, and there actually is research studies that show that librarians are one of the most trusted professionals in the country, above nurses. and well above physicians. So that was like, well, wait a minute, why don't we do more with libraries? And I started to look and see what was out there in library world with respect to bridging with healthcare teams and science teams like mine. The opportunity was born. I searched the National Library of Medicine for funding opportunities, and there was this wonderful GO8 mechanism. And I reached out to the libraries, both the Health Science Library and our Chicago Public Library, and they were game to partner, and we did it. And the rest is kind of history.
Awesome. Thanks so much for sharing.
Angela.
So for Chicago Public Library, we thought it was important to kind of bridge the gap and clear up any stigma that our patrons in our 79 different communities have about clinical trials. There are a lot of misconceptions. And so we thought that partnering with this organization would help our patrons. And we also learned a lot about clinical trials. Myself specifically, I also had apprehensions, but after participating in quite a few of the online events, when we had to go virtual due to the pandemic, it opened up a whole new perspective for me. So I think that as far as CPL goes, we found that it was easy. It was informative. We set up a tool for our patrons to be able to easily participate, and we got a lot of positive feedback.
And just one more thing, libraries are true assets across many communities, regardless of how poor some of the health indicators are in communities. Always, it's important to take a community, an assets based approach and a positive approach. And some of the true assets in communities across America, but also Chicago, are the libraries.
Thank you, Dr. Simon. I wanted to follow up to see if Nemo and Will have any highlights that you want to share.
Yeah, so highlights of the project thus far is, so even early into the development phase of the project, right, we had multiple collaborations, as Dr. Simon said, with UChicago, with UIC, with Northwestern's library as well. And when it came to the website itself being created, followed an iterative process. So we started with the poster cards, and then we had like 7 iterative design processes, and all of those were done with Chicago Public Libraries. And when it came to really starting the project itself, it was going to Chicago Public Library executives and having them identify 6 libraries that we could then go and do iterative testing with. And these were libraries that were identified based on covering the southern part of Chicago, the north part, and then the central part of Chicago, and to make sure that we had covered as much of the diversity of Chicago as possible. And then our iterative process involved checking in with library staff and library patrons and getting their feedback. And so I think we went through like 7 design thinking processes where we got feedback as it related to whether or not they thought the information was too formal. It's because of the feedback from participants that we realized that it was important to provide factual information for those who, when trying to figure out what to do with clinical trials, just wanted the information, versus also including vignettes and personal stories for those who exhibit a lot more distrust, a lot more hesitancy, a lot more skepticism. So it was balanced in how do we include factual information with personal stories. And so it was really getting the feedback from people that then led us to create the first website, and then led us to create this final website that we're now deploying and testing. So a lot of the highlights of this project has really just been working with patrons, talking to patrons, and really seeing that light bulb moment of like right now we're recruiting in person at a variety of the, I think, 5 public library branches. And we still have people who, they'll see the sign, they'll see clinical trials, and they say, oh, I don't want to be a guinea pig. So there's still a lot of like heavy mistrust that we see in person. But then we'll have someone participate. I remember a patron who participated and was like, oh, I didn't know this about clinical trials. I didn't know this about consent forms. I didn't know that I could say no, or that there were these different types of clinical trials. I think there's warranted distrust of clinical trials, but I think there's also a lot of misinformation that people still have. And so seeing, again, that light bulb moment of like, oh, I didn't know all of this, but here's this website that kind of breaks it down and makes it easy for me to understand, and then kind of correct some of the misinformation that folks may have. I don't know if Will has more to add, or Rabih has also just joined.
Yeah, I would just completely echo what Nimo shared. Most of my role on the project has come with this piloting and recruiting participants for engagement with this final website draft that we're working on and still garnering feedback on. And I think there are a few other questions later in the panel about some of the feedback we've received. But yeah, completely agree, Nima.
Thank you for sharing all that. And I think Eileen unmuted earlier. Did you want to add anything?
Yeah, so again, echoing what Nemo said, my name is Eileen Wafford. I'm a research librarian at Galter. I've been part of the project since after Melissa, submitted the grant and it was accepted. I pretty much joined the project at that point. I did see the project start with the flashcards that Dr. Simon, Melissa Simon, and other researchers produced from past research. So these were scientifically based, evidence-based information that about clinical trials that people need to know to, again, address misinformation, to address distrust. And at the beginning, we started off with focus groups, going to those 6 libraries. And we started with focus groups. And there were people who were like, you know what, I'm just here for the money. I don't trust, because we were giving out some, not a lot in the beginning, but they did get like little gift cards or something to join the focus group. And so someone's like, I don't trust clinical trials. I'm not going to be a guinea pig. But I'll sit down and go through this. And then this person literally was part of the process. He saw the flashcards. He saw like the first iteration of the website, and then he saw the final results. So he was part of all these focus groups and later usability testing. And at the end, he was like, I'm converted, like sign me up. Where can I find more information? So it was really, I wouldn't say it works, but it does, the website did serve its purpose, at least for that one person. Like it helped address these misunderstandings and to see that process. It was, I think, like a 2-year process, and seeing that with this one person, and it was more than one person who we saw this change happen. And again, this wouldn't have been possible without the Chicago Public Library. So the librarians were really, really key into recruiting, helping us recruit, and making sure that the flyers that we produced were visible and sharing that with their patrons. So that's the highlight from my experience with this project.
Thank you. Is there anything else any of you want to add about the partners and how did the collaboration work?
I think something that was really important is that there were a lot of meetings, and this was pre-COVID that we did in-person meetings at the Chicago Public Libraries, and thankfully there was a downtown branch that kind of worked for all of us to connect at. We brought food into the library and coffee, and it was good. Breakfast meetings. And what really was important to building the relationship and the partnership, I mean, that was first. That was about connecting with people and building that trust, trying to, again, go over the research part of things, and then try to make it real and value added for the patrons and the librarians of Chicago Public Libraries. And there was a
will-
lot of design input, right? Each of those meetings, each of those meetings helped us move a little step forward towards the product.
Yeah, and I would add to what Melissa was saying is that it was really important to get the librarians' input into the design of the website, as well as into the dissemination in their libraries, because we're going into their space. They know their patrons. We didn't always get it right. Like there was a time we're like, let's go at this time. The library was empty. We were there for hours and it was empty. And we had to, regroup and say, what did we do wrong? Like we didn't really consult with the librarian, and they would say like, yeah, this is a really quiet time for us. So, but it was really important, as Melissa said, to get their input and feedback during the design process, as well as the dissemination and programming process as well.
Awesome. So we're hearing about what it was from the center's side and Galter Library. So what was this collaboration like from the perspective of Chicago Public Library? Angela, if you want to share a little bit.
From our perspective, it was surprisingly easy. I wasn't a part of the initial processes that it took to get to the point where we were doing the presentations, but in terms of the response that we received from patrons and staff, it was very positive. Part of what we did to promote the program, we created flyers, we put information on our website, we created bookmarks, and our patrons really responded to those things. Also, it was great that when the pandemic hit, that we were able to pivot and still be able to provide this valuable information. So I would say from CPL's perspective, it was a home run.
And that pivoting was challenging, but it was challenging to us all. And to have the information about clinical trial participation, especially for diverse communities, was really critical, as we saw with for example, the COVID vaccine trials, and the initial lack of diversity in the COVID vaccine trials, the Moderna one being the most prominent example, especially in the United States and the Chicagoland area. So again, this was a good timing as well with respect to what we had built prior to the pandemic, and then the pandemic hit, and then we pivoted to online.
I'd like to also add that being able to provide that online component during the pandemic, when the clinical trials were coming about for the various, for Moderna and for the Johnson & Johnson vaccine, it was a pivotal point, because it for some of our patrons, it may have had an effect on whether or not they decided to get the vaccine, and also for some of our staff. So I would again say, being able to do the online piece, providing all the information and dispelling a lot of the myths was really beneficial.
Thanks for sharing, Angela.
Can anyone share any feedbacks or comments did you receive during the work with the program participant? Do you think this project made a difference in how participants view in clinical trials? I think Nimo mentioned a bit earlier. If anyone else want to share.
I can speak to that. Recently, actually, for our Black History Month, we had a presentation with Dr. Simon and several others, along with a clinical trial participant speak. And the feedback that I received from that event was phenomenal. They were able to ask the doctors questions about, did they have to participate if they decided to change their mind? Would their samples be used for other things? So it cleared up a lot of, again, the myths associated with clinical trials, and then hearing from an actual participant was really beneficial for our patrons also.
I'll also add, so currently Nemo and I are working to garner feedback on the current form of the Health for All tool, this web tool, in libraries through in-library recruiting. We've been able to pivot back to some in-person recruiting for the study that we currently have going on concerning the Health for All site. And I think anecdotally, a few things just in terms of feedback that we've gotten is that people really appreciate that we are working directly in libraries. And I think that's due in part to the work that the libraries have done. You know, people are familiar with seeing, you know, community-based organizations at tables in the entrances of libraries. So oftentimes folks are curious, they're coming up to the table, they're asking questions. And then Nemo and myself being there are really able to answer some of those questions, you know, about the tool. Hey, can I send this link to a friend of mine? So really leveraging, you know, community-based networks has been really neat to see. Something else I'll add is then the librarians, the role that librarians have been playing is really important. So Nemo and I are in person recruiting for the tool's use a couple days a week for a 2-hour period. And oftentimes we're not there. But I think what we've been able to do is when we're not there to answer questions, librarians, because of their work with the project and knowledge of the project, are able to answer some of those questions that participants might otherwise have for the study team. So really beginning to work to include everyone working in a single space on the project, I think has been really awesome, and participants and community members have really appreciated. So anecdotally, I think, you know, that's been really huge for us. Being able to return back to in person. I think people really appreciate the presence within the library, and that's due in part to the environment that libraries hold and have created within communities.
So what other work did this project inspire? I know Dr. Simon mentioned a few spin-offs earlier.
I can speak a little to this. So as we are in the process of wrapping up the clinical trials project, we have also recently launched 2 of our other, it's one study, but assessing 2 separate websites. And as mentioned earlier by Dr. Simon, that's the Navigate in Wellness and then Well Mama. And so I think right now we're in the process of doing the usability phase of this study, where we're recruiting participants. Many of them are actually former participants of the clinical trials. So again, that speaks to the trust that we've been able to develop with our participants, where after doing the clinical trials, they're like, hey, let me know when you have another study, I'll happily do it. And so a few of our most recent, so it's still in the early days of it, but a majority of our most recent participants are those that did the clinical trials. And so now we do Zoom sessions with them and sort of assess how they're interacting with the different websites. We get feedback on the information, and it's folks of different health literacy levels as well. So we get to, I think I held one session yesterday, and a lot of feedback was garnered with someone who said, oh, you know, like this is good information, but it's a bit dense, or the layout or the font, or then getting feedback like that, I think helps us truly determine how to make the website as user-friendly as possible. And so short answer is we have launched our 2 new websites, and so we're now in that usability process and recruiting participants and getting feedback.
And critical to this, the next phases as we move forward, is understanding that not everybody is going to want to access this online, and how to create programming within the libraries, with librarians leading the way, about accessing these different types of critical information. So the clinical trials participation, or just information about being a consumer of clinical trials or a participant, but then also navigating wellness of what preventive services you need for whatever age you are and for whatever sex you were assigned at birth, like things like that. And then how to connect to a local clinic if you don't have insurance, or if you have insurance. All of those things are really critical. And if you're a new mom or soon to be, and you're trying to figure out and navigate the waters on certain aspects of prenatal care, things like that as well. So helping to build their programming that will then connect these internet tools is really important.
Thank you. So my last question is, what is next for this team?
That. But I want to say one thing, because I am a real proud mama. And, two of the members of this team, Nemo and Will, actually are going to medical school. So in the summer. So again, this type of work and partnership is so critical to so many different dimensions, and includes the workforce. And so we have future physicians who have done this work and who have partnered with libraries and who've worked with patrons of libraries on these really critical topics, I think is a really good pre-education for medical school and for becoming a really amazing physician. So that is another exciting thing that is next. But scaling this beyond Chicago is going to be critical as well. And I don't know, Eileen and Christy, if you even want to speak to that.
I'll just say a couple of brief comments, and then if Eileen has thoughts, welcome her to weigh in. But I will say that this is a project. It's been really rewarding on a number of different levels. First of all, we've been able to be part of this terrific team that spans several different organizations. I feel like I'm constantly learning on the project. And so I have felt like I've had an opportunity for personal growth, but it's also been an opportunity for our library to, stretch our wings in terms of the types of collaborations that we can engage in. And so we've had a number of organizations, other libraries have reached out about this, and I'm thrilled to share our experience, but it would be, I think, a great opportunity for community building and capacity building at libraries to be able to have some ways of sharing this more broadly. So this is one of the reasons we're really excited to be part of this panel today, is to be able to share this with the community at this event, and and maybe spark some future conversations toward that end. Eileen, do you want to share your thoughts?
Yeah, definitely think that this is scalable, and just getting the word out there, working with your team, through manuscripts, maybe in my liaison areas, I work with many different faculty based at Feinberg, and many faculties who are collaborating with other colleagues throughout the nation. So just kind of sharing what we're learning and doing with your team, with other groups that we're already working with Northwestern, who may not be aware of your work, would be, ways that we can, spread the word and maybe facilitate collaboration with your group, or at least help them connect with you and your team to understand how they can do something similar with their organization, their communities.
Thank you, Eileen. Yeah, no, I look forward to scaling this and thinking thoughtfully, even at the National Library of Medicine level, of how this could be infused. Of course, we will need some funding to scale it. Of course, as always, the devil's in the details. But I think even having the Chicago Public Librarians and our Galter Health Science team, including yourself, Eileen, helping to lead the way and how this could be diffused throughout libraries across the nation.
Yeah, absolutely. I think there are some great opportunities here, and I think there's a lot of enthusiasm for investigating those. So, I would encourage others who are interested in these kinds of partnerships. The partnerships, I think what we've been able to see through our time together today, I mean, this is a real dream team, because everyone's able to bring their perspectives and their experiences and their understanding of the community, particularly with Angela's case where she's working in CPL, working directly with the patrons. And that was just really an incredibly critical ingredient in the success of this project, is just to be able to have all of this be informed from different perspectives. So I do think we do have an opportunity to be able to continue to think about this in meaningful ways and to begin to continue to evolve the way that we approach these kinds of collaborations, so that they're inclusive and they're forward looking, and they really enrich the communities in which they sit, because that is key. So one thing, if I can ask one final question myself, is I've been, throughout our collaboration, it's been several years now, and we've been able to watch, as we've heard, the transformation of the physical cards to this online system and grow this community of practice around this project. I'm wondering if the different panelists would mind sharing a little bit about if there were any lessons learned from the collaboration, anything that surprised you, or anything that you want to share with the audience that might be helpful as they begin to think about different kinds of collaborations in their own organizations and communities. Maybe good, Eileen, please. Thank you.
A big lesson that I learned would be just leveraging and understanding everyone's unique contributions and skills, and not just what's on their resume and CVs, but how they can contribute. Maybe someone's more outgoing and personable. That person might be someone who does well, with recruitment. So I just think understanding and leveraging everyone's skills and experience and abilities is a big lesson I learned.
Yeah, I think trusting everybody's role and making sure that role is embraced, and because it does take all of us, our individual skill sets, collectively to create this type of work. And stick with it, right? And admittedly, the beginning of this project was very slow. We had to figure out who each of us were, what were we really trying to get out of this? What was but even when you can't see that staircase, Dr. King said it well, you just take that step and you will see it. It will come. So.
Hi, everyone. Can you hear me?
Yep.
Hi, Rabih speaking. Sorry I can't be on camera. Thanks to everyone for giving all the feedback. I just wanted to add, another thing learned is that not assuming that we have all the answers, as we do have access to all this wealth of information and publications and what's considered best practices. But once we got on the ground and we were in these libraries, and each was their own unique ecosystem, and having the patrons really level with us and tell us, actually, there's something that doesn't work, and our approach and how we presented fundamentally changed based on their input, which was really great to see. And so I think keeping an open mind and really being receptive to each of the person's feedback is, because we see them as part of the research team. They're the ones that helped us to co-design these research tools and to bring us where we are. But again, thank you for hosting us.
Wonderful. Are there any other comments that anyone wants to make? Okay, well, Nihmo, please go ahead.
No, just the last thing that I'll add is being very open to being adaptable. So again, we had to really pivot how we were delivering this website and this research to our patrons when the pandemic hit and we couldn't be in person. And, you know, there were growing pains. There were a lot of instances where like we tried something, it didn't work, and we had to reassess. So also just being very adaptable and being willing to take feedback from participants as to how they want information delivered to them as well.
Absolutely. That is a great note to end on. I think keeping this very user-centered, thinking about our communities, our patrons, and delivering high quality, dependable information in meaningful ways that work for the community is, I think, a really important part of this. So I want to thank everyone who was able to participate in the panel today. And I want to thank our attendees for joining us for the conversation. As a reminder, this is being recorded and will be available on the NNLM YouTube channel in about 30 days. And so I encourage you to take a look there, and do feel free to reach out if you have any questions about this project or if you'd like to chat more. I'm sure that we'd be happy to continue the conversation. Thank you all very much, and we look forward to seeing you in the next session. Bye-bye.
Bye, everyone.